Hi, my name is Avni and I work at Al Harub Medical Center as the head of learning and development. I welcome you all to this podcast called Mind Matters by the Arabian Stories. Through this podcast, we intend to, talk about mental health and spread awareness about mental well-being. So, yes, welcome. And to start off with a very simple question, what do you mean by mental health? Is a question that you would have come across a lot of times. So, mental health is basically your mental well being, that is, your thoughts, your emotions, your feelings, how you relate to others, and how you handle stresses in your day to day life. It is important for everybody to remember and note one thing, which is that somebody who is mentally healthy is not going to necessarily be happy all the time or confident all the time, or it's not like they don't have problems. But it is people who are able to bounce back from problems, who are able to effectively deal with challenges in their day to day life. So that's somebody who is mentally healthy. And it's also important to note that all of us, like we all have a physical health, okay, where we look after our bodies, go to the gym, eat well, etc. We also need to look after our minds, which is looking after your mental health. So, moving forward, let's talk about how the society's view about mental health has evolved over all these years. So historically, people with mental health concerns were often misunderstood, and they were stigmatized, they were treated badly, and they were categorized as crazy, or people did not understand what was really going on. However, and thankfully, we have, shifted from that. And today, our society is more accepting. There are services that are available, and everybody is talking about their mental health concerns openly. There are discussions, forums available for people to share their stories and seek support from one another. Today, in the society that we're living, all of us are able to acknowledge that mental health is just as important as our physical health. And I think that moving forward is something we all must keep in mind. Stigma still exists. People still are held upon some of these beliefs. People don't really have a clarity, but I think with increased education and awareness. So, like I was saying, as we've moved forward, and the society that we're living in today is far more inclusive and accepting, and it's definitely a sign of progress. So yeah, I think there's more help for all of us to reach out and support one another in terms of being there for each other. So, moving forward, let's get to the last segment of our session today, which is what are some of the common misconceptions related to mental health. The first most common myth about mental health is that mental health problems are rare, which is absolutely not true. Millions of people all around the world are experiencing mental health problems, and like I mentioned, this is just as falling sick and going to the doctor. So there is no shame, and there should be no stigma that's attached to seeking out for help. So yeah, they are definitely not rare, and 1 in 4 people are affected by mental health concerns. And these numbers are only increasing or have been increasing post the pandemic. So, yeah, there should be more support, there should be more conversation that helps us, create more awareness so people are able to get the treatment that they need. Moving on to the next myth. I have heard a lot of times that people tell me that, if somebody is facing a mental health problem, it's probably because they are weak, and, they are not, strong enough, and emotionally they are not strong enough, and they're not able to fight it all. But that's not true. Just like, when somebody gets diabetes or gets cancer or gets a heart failure, we don't say, oh, this person, did this and that's why they got this. It can happen to anybody, right? So similarly, even with mental health conditions, it's not like somebody necessarily has to go through something traumatic. Yes, traumatic experiences definitely can lead to mental health problems, but even otherwise, there is no necessity that you have to go through something. It could be your genetics, it could be your environment, or it could just occur out of nowhere. So mental health problems are very common, and just like you would treat somebody with a physical health condition, for let's say somebody got a fracture, we would go and show, be empathetic towards them, be there for them, ask them if they needed something and support them. That's exactly how you should be treating somebody with a mental health condition, or somebody who is mentally distressed. Lastly, I think my most another myth that I have come across mental health would be that you can just snap out of mental health conditions, and you can just talk it out to your friends and everything's going to be okay. So would you say this to somebody who's got a fracture or somebody who's got a heart attack, that just sleep it out, you'll be fine the next day? You wouldn't. You need to take them to the hospital, right? They need medical attention. Similarly, it's important for us to realize that just like we treat physical illnesses, we don't see any shame in going to the doctor. Similarly, when a person is experiencing a mental health condition, there should be no shame attached to seeking therapy or going to a psychologist, seeing a psychiatrist if there is a need, and taking the therapy and the medication you need and require. So yeah, I guess that's about it. So thank you for being here with me in this session today, and I look forward to being here again soon.